go, 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 go. That's the birthday. That's the birthday.
What is happening, Zed Pack? It's your boy, Z Diggity. I'm here with Tom Heineberg and Logan Stewart.
Yo, we run the board and stuff.
They don't do anything, but I don't pay them, so it's all good. Hey, we're coming early though, like hella early, as they say in the dirty West, because I got to be on a flight tonight because I'm going to Tucson, Arizona. Tucson? Tucson.
Yes.
Like Tucson Sam. Mm-hmm. And I'm going to be speaking for Marana Health Clinic Healthcare. It's a federally qualified healthcare.
Oh, dude, you know what's dope about Tucson?
Meth?
Nothing.
Meth.
That's racist. I'm not sure against who, but it's not right, because Tucson is dope. And the thing is, it's interesting because I'm going to speak for a federally qualified healthcare system, or FQHC. And today we're going to talk about Jimmy Kimmel's entitled baby, because that baby thinks he can just go wherever he wants and get health care, that he can just get hella heart surgeries and he can just rag on whatever senator, and we got words to say about that. I'm not sure what those words are yet, but we're going to incorporate your words too. What do you think, Z-Pack?
I think we're ready to do this thing.
Let's do this. Heineberg, what's the story? Wait. First.
Oh, you got it, yeah.
Mexico. I've been getting messages from Z-Pack fans who are doctors, nurses, etc. in Mexico City and other parts of Mexico, and they are, first of all, begging us to spread the word about the tragedy that's going on there with the earthquakes and the fact that the frontline healthcare workers, just like in Hurricane Harvey, just like in Hurricane Irma, etc., are struggling, and we want to give them Z-Pack support. So we're thinking about them. We're hoping everybody's safe. Our thoughts are with the victims and with the frontline responders, emergency responders in Mexico. So Z-Pack in Mexico, we have not forgotten about you. We're thinking about you. And when any of us around the world are under siege, we are all under siege. So we are feeling you guys and hoping for your safety. That being said, screw entitled bitches. That should have been what you wanted to call this, Tom, because you two conservatives think that Jimmy Kimmel is being an asshole with his baby. Is that right? Wow. That's actually true. But is that true? Are the taxpayers paying for his health care?
No, Jimmy Kimmel has private insurance,
That's
I'm
right.
assuming, or through ABC or whatever, right? But so here's the story. So a long time ago, the people that watch Jimmy Kimmel show will know that his baby had heart complications, and we talked about it on our show. And he went and gave an emotional monologue about healthcare and healthcare reform and Obamacare, basically saying, if he hadn't been so fortunate to have $35 million, that his baby would have died, right?
Right.
Do you remember those?
I remember it well. I did a show about it, yeah.
Yeah. What was the condition the baby had?
He had, I think, a tetralogy of Fallot, so an overarching aorta, the atrial septal defect, et cetera, pulmonic stenosis, that sort of deal. The Tuesday around here.
So anyway, so Bill Cassidy, this GOP senator, GOP grand old party people, they really need to change that. Anyway, this Republican senator came on Jimmy Kimmel's show and said that the bill that they were working on, the Republican health care bill to repeal and replace, like they keep saying, was going to definitely cover conditions like Jimmy Kimmel's son had for working class families. Jimmy Kimmel read through the health care bill and determined that Bill Cassidy had basically lied to his face, as he put it on his show recently, and he called this dude out for it. And so now there's this big debate going on where people are saying, listen, Jimmy Kimmel's just a comedian. He's just some late night talk show host. Like, what the hell does he know about healthcare? And so I brought this up to you. We were talking about it earlier before the show, and you said, what's anything have to do with it? You think this isn't a healthcare debate at all, that this is just pure politics, right?
It's entertainment and politics. Like, fucking, what do the senators know about healthcare? They don't know shit about it. They get the best healthcare plan around in the Senate. And what does Jimmy Kimmel know about healthcare? Well, his kid was sick. And actually, someone pointed out that they said that when a baby has a birth defect, they immediately qualify for Medicaid. Now, guys, Z-Pack confirmed that. I don't know anything about that. If that's true, then the government could be assisting in paying for Jimmy Kimmel's baby's tetralogy of Fallot repair, et cetera. So the thing is, neither one of them knows shit about healthcare policy because they are not clinicians, either one of them. And I think if you're going to talk about actually transforming healthcare and reforming healthcare, it has to be a doc.
Apparently, Bill Cassidy is a doctor.
Okay,
Senator.
fuck me.
Yeah.
I don't know what I'm talking about.
Let's see.
That's embarrassing. So wait, so he's a doc.
Paul O'Banion says Bill Cassidy is a physician who lost his way badly. So
wow. Okay, now, because again,
agree.
Tom was like, let's talk about this. And I'm like, I don't know shit about it, Tom. You're going to teach me on the air about the actual story
This is what it looks like when Z gets taught on the air.
So now you see my true elephant reaction. Okay, so Bill Cassidy's a doc. I assume he's a Republican, yeah?
Yeah.
Jimmy Kimmel is not a doc, but he's a child with serious birth defect and gave an emotional speech about it that we talked about previously. Now, here's the question. Even though Bill Cassidy's a doc, the question is, and I've talked to people who've been in the front lines at Washington, sort of either as lobbyists or as clinicians for big healthcare systems trying to interface with the Senate people, and they say, these people know nothing, Jon Snow, about healthcare at all. And so if Bill Cassidy's actually a doctor, then at least he has that perspective. And I've always been an advocate of clinician leadership. Now, I haven't read the new repeal and replace bill. I haven't done any of that. You know why? Because I don't give a fuck. And I'll tell you why. It's all bullshit.
Preach.
It's all bullshit. Nothing in those bills is health care. It's either political tweaks, it's entitlement stuff, it's insurance reform or insurance change, not even reform. What are you reforming? Insurance is a fucking shitstorm. So it's really about how many deck chairs on the Titanic can we shuffle. None of it controls costs. None of it changes the delivery model. None of it promotes Health 3.0. So I don't give a fuck about it. Whether they put that in as the law of the land, or it's continued Obamacare, or Obamacare with tweaks, or it's this or that, or it's expanded Medicaid, or it's this or that. None of it means shit. None of it is transformative. None of it changed the model, and none of it does what we need, which is incentivizing proper outcomes, incentivizing integration and accountability and defragmentation, incentivizing technology that actually helps us take care of patients instead of getting in the way, incentivize paying administrators and hospitals to actually do good for patients and staff, and thereby doing well financially. None of this shit does any of that. None of the shit in Europe does that. None of the socialized medicine programs do that. Nobody on earth yet has figured out how to do this. So am I going to stress out over every revision to every bill? No, fuck no, because I got better things to do, which is trying to think about with you guys. We're clinicians. What the fuck would we do to totally revamp the system? And we talk about some of it every day on the show. Am I insane?
You shut your dirty mouth. Scandinavia is killing it. They figured out how to live forever. They have the literal fountain of youth over there, and you want to stop that, you immoral pig? How dare you?
Fascist.
How dare you? How dare you? I'm going to get up on my high horse right now.
Get on that high horse.
This is how high morally, Z-Dog, am.
Tom dropped his mic, yo.
Tom literally dropped the mic. He's the first human being to drop a lavalier mic on the ground in anger. Well, here's the thing, Tom Heineber. I guess if you mean the fountain of youth is like eating lutefisk and being white, then the Norwegians have it dialed. But here's the tweak to that. I got a message from a Norwegian medical student, private message, and he was like, hey, Z-Dog, stop saying how great Scandinavian healthcare is. It's a shitstorm. It's based on this and this. It's a bunch of shuffled stuff. They abuse this and that and this and that and the other thing happens. So not everybody is in agreement that Scandinavia is great. Now, when Robbie Pearl was on the show, he said he went to Sweden and he actually found their morale to be very high on the provider side. But again, short of us going there, which means ZPAC, you guys got to fund a Team Z trip to, just pick a Nordic country and we'll go there. Finland. And we will just examine everything that's going on. But I'll tell you, it's not gonna apply to the US. You're gonna find some of it that applies, most of it isn't. You talk about American exceptionalism. Logan will talk about American exceptionalism all day. Here's the exceptionalism. We are an unusual country in that we actually have the opportunity, because we have such a shitty non-system, we have the opportunity to do it right. Because we don't have to, we have a lot of inertia, we have a lot of lobbyists, we have all that stuff, but we don't have yet a entrenched government system beyond Medicare, Medicaid that is going to be immutable. So we can fucking do it right, which means it's got to be led by us. It's got to be led by frontline clinicians and people who've been working in the game. It cannot be led by, dipshit McSenator, Dorcas McEntertainer and comedian, or liberal or conservative McGee. It's got to be actually all of us on the front lines that are leading it.
See, Kaylee says she's RN in Utah, and last year the politicians tried to implement a fee for healthcare providers to expand Medicaid.
Sorry, say that again. Explain that to me again. They wanted to do what?
Last year in Utah, they attempted to charge an annual fee to supplement Medicaid expansion, charging
Only
healthcare providers, doctors, nurses, respiratory therapists, etc., to fund it. My husband, a physician, already takes a hit each time he sees a medical patient. Didn't pass, but
Medicaid.
Scary that politicians are thinking in that direction. Sorry, Medicaid. patients.
So they're trying to charge healthcare providers for Medicaid.
Why the fuck would you penalize healthcare practitioners and professionals to subsidize the care for poor people? This makes no sense. As it is, Medicaid is like a subsistence wage for anyone who bills for it. Doctors want to take care of people who are unfortunate, who do not have the resources to get standard insurance. They do. We go into healthcare to help people. Why would you specifically target us to penalize? This is why it's very hard to find a practitioner who takes Medicaid or a surgeon who does this is the backwards way of thinking. Doctors' fees, those fees from healthcare professionals, are not even the vast majority of where our healthcare money is wasted. Now the thing is, look, if we get the care model right, then doctors don't even we're much more efficient at what we do, and we don't need to charge a ton of money. The thing is, if you think we're gonna go through all that school and all that training and all that heartache and all that debt, and then be paid a subsistence wage where we're penalized for the fuck-ups of government that can't get its shit together and take care of its most vulnerable people, fuck all y'all. Like, we're gonna go do something else. Like, I'm gonna be a Tom and wear glasses, shades during the day, and break my finger playing some drunken video game.
That's right. I'm doing PT on my finger now. Look, I can get it this far. Pretty good, pretty good.
Tom has a lot of PT left to go, man. We're like rooting for him because he may be permanently finger jacked.
Jessica Bow says, whatever, Z-Dog. Dorcas McEntertainus is actually pretty smart and knows a lot about healthcare and science.
Are we talking about Jimmy Kimmel?
Yeah. She said science and politics, sorry.
I'm
I don't
sure
want
he
to
does.
misquote her.
Well, he probably has writers and he has support and all that. I like Jimmy Kimmel. I think he's great.
I like Jimmy Kimmel too, but shut the fuck up.
Well,
How about that?
I mean, we say a lot of shit about shit we know nothing about, but we use the credibility of being healthcare people. At least one of us is a healthcare person. So I can see Jimmy Kimmel using his bully pulpit the way that he's going to do it, and that's great. And he's funny, and humor is a great way to get into people's hearts and minds. And so, again, I jest a little bit, and then I'm taking a shit on him. It's more that nobody fucking knows. And the thing is, if you're going to attack
It's
somebody as a
easy,
liar,
though, to sit up there from a privileged position, and you're worth 35 or 40 million dollars, however much he's worth, and you say everybody should have health care. Like, yeah, dude, who pays for it, man?
Yeah.
Who pays for it?
Well, and again, it gets to this question. We've done shows on this. Is healthcare a right or a privilege?
That's what
My
we always
answer
go
is,
back
why
and
the
forth
fuck are you
on.
asking such a stupid question? That question has nothing to do with the actual answer. The answer is, how can we deliver amazing healthcare efficiently that takes care of both providers and patients in a cost-effective way that has real outcomes? That's the question we should be asking, not is healthcare a right or a privilege. Do you have the right to really shitty healthcare that will harm you? Because that's what would happen right now if we just covered everyone across the board and said, okay, access the current healthcare system. You would be fucked, because you would access a piece of shit, because that's what our system currently is. I talked about this with Robbie Pearl. It sounds like I'm being hyperbolic, but you get overtreated or undertreated. The doctors and nurses in different systems don't communicate with each other because there's no incentive to do so. We're not incentivized to work in teams. We're not incentivized to deliver actual outcomes in a 3.0 way. So sure, you want to destroy the country, cover everybody in a shitty system. Fix the system first, then you'll be able to pay for it. And I don't care if it's single payer. I don't care if it's employer done. I don't care if it's out of pocket, as long as it's affordable and it's not going to destroy the country and it's fair. If we can do that, what else do we need? And we already know how to do this. Focus on primary care prevention, focus on lifestyle stuff, okay? Work on the idea that a medication is a failure in a way. You ought to be preventing needing to use a medication. And once you've failed, then how do you optimize the treatment for the biggest conditions that cause the most expenditures of dollars? and take care of the people who are taking care of you. Don't hit them. Don't make it okay to punch a nurse or a doctor or kill someone. Come on, dudes. Like, this is not, it's not fucking rocket science.
One of the things I've heard, and like I'm no expert, obviously, but one of the things I've heard is that the big problem with Obamacare was that if you're going to mandate that everybody have insurance, the penalty for that has to be a lot higher than it currently is. So what the Republicans are doing is repeal and replace means just strip away that penalty, but keep the coverages. That's fundamentally infeasible and paradoxical. You're going to have to up the penalties to a crazy degree where it really penalizes you to not have health care. Otherwise, the insurance companies can't bear the burden of it.
Well, and again, this is the policy side of it, which is if the Republicans really want to destroy Obamacare, the way to do it is take away the individual mandate, because that's going to ultimately destroy Obamacare, because you're not going to get healthy people who are compelled to buy insurance that lowers the risk pool and pays for people who are sicker. Because right now you're saying, okay, Obamacare says that there can't be any pre-existing conditions that will prevent you from getting insurance. You can stay on your parents' insurance until you're 26, and there's no lifetime limits on coverage. Well, in an actuarial way, for insurance numbers, this makes no sense. It doesn't work. They won't be able to make the ridiculous profits they make. So they're going to push back by either pulling off the exchanges, which we see, or reducing coverage in different ways, or raising premiums. And you see all those things happening. So it's a subtle sabotage of what the initial intent of the bill is. Now, whatever you think about Obamacare, it has opened the door for the conversation now where people are talking about, well, what is the government's role in healthcare? It's already really, really high through Medicare, Medicaid. How can we make it actually efficient? No one's asking that. How can you actually make the government's role effective? Because it's already there. You're not going to get them out of healthcare, right?
You can't.
Now, one of the things that we're going to have a guest in October 1st, Dr. Newhoffel, he's going to talk about how we might be able to do this in an efficient way with physicians leading it. So this is why we want these folks on our show to talk about it. Robbie Pearl talked about, well, single payer doesn't make a lot of sense unless you fix the model of care. You do that, then it doesn't matter. ACOs don't work so much because there's no teeth around all that.
Check it out. No matter how good the ideas are, they don't respect you and they're not listening to you. Straight up.
Who are you talking about? The government?
Politicians, yeah.
Well, it's not a question of respect. They have no incentive.
Exactly.
Am I giving them donations?
Who's writing the incentives? They are.
Well, the incentives are, let's see, pharma lobbying, insurance industry lobbying, hospital lobbying, medical device lobbying. What happens when I lobby? This is my lobbying. I go on Facebook Live and there's 927 people and I go, hey Congress, fuck you guys. How about you do some shit that doesn't suck and we can help you? Are they gonna listen? Hell no. But here's the thing. There are people working in government and they communicate with me. They do want to do the right thing, but they are hamstrung by all these other things. I don't think our senators across the board are so evil or bad. It's just all the incentives are misaligned. It's like when we talk about healthcare. If you have a fee-for-service system, then you're going to do shit to people instead of necessarily for people, and you're going to justify it that this is how you do it.
Yeah. How do you get rid of all those lobbying dollars? I mean, this is a system that's been in place for 50 years. They've been generating this system. The wealthiest zip codes in the world are all around Capitol Hill. They're all in Washington, D.C.
Shut down the federal government.
That's all lobbying. That's all lobbying money,
Rise up.
right? And like the pharma lobby and all the lobbies you talked about. We can't go up against them. We don't have the power.
Yes, don't we?
We got guns.
How many healthcare practitioners are there in this country? About 12 million plus. There are 3 million nurses alone.
Okay.
We pull all the levers of delivery and yet feel like we have very little power. Our lobbying organizations like American Medical Association, America's Nursing Association, America's Hospital Association, they only each take a little stab at it from different angles. Now, what if we all kind of got together and said, no. We want to actually get paid for proper outcomes measured correctly. We want to actually have support. We want to work in teams, and some of us don't, but we want to be integrated into the bigger fabric of our communities in a healthcare sense. If there was one electronic health record, that would be a nice way to do that. And we want to get paid for what we do. And whether medical school is free or nursing school is free, or whether we just get wages that are consistent with the amount of debt and work we put in and the outcomes we obtain, why can't we do that? Now, the thing is, what will trigger this is Logan saying shut down the government, Tom saying it's not going to happen. I'm saying what would trigger it is a complete collapse of the U.S. economy, which is what we are heading towards at our current rate of medical inflation. So it's not sustainable. The big entities, by the way, guys, like this wasn't true 10, 15, 20 years ago. The big legacy players, the insurers, the hospitals, et cetera, they see the writing on the wall for the first time. They know the bottom line, this is not sustainable. So they're already putting things in place to try to figure out what is the 3.0 way. It's just going to be slow, and you guys on the front line are going to have trouble seeing it. But I see it because I travel around the country and I interface with these leaders. And this is what's happening. But it's very tough because right now they're straddling two worlds. There's the old world of fee-for-service, volume-based crap, fragmented, paid for all these payers, and the new world. And how do they justify to their shareholders having a foot in each? They have to be really careful. It's a real struggle. I don't envy them, but I want to support them, actually.
So what is the black swan event that causes them to get up off their ass and do something about it? Because they're not going to just do it gradually. That's not going to happen. There's going to have to be some catalyst.
You know, it ain't Jimmy Kimmel's baby.
Right.
Because I think what Jimmy Kimmel's baby is, and you guys got to understand, again, like, where our politics are. So these two are on the right of the center. I'm just to the left of the center. So Jimmy Kimmel's politics is somewhere in the space of there ought to be a universal coverage that takes care of our most vulnerable kids, even if his kid isn't necessarily vulnerable because he's a multimillionaire. That politically means a kind of single-payer expansion of coverage in his world view. Now, the right will say, well, no, it ought to be, you have to make it more efficient, the government can't do things right, et cetera. So what's the balance? Have clinicians and healthcare people lead a transformation in systems called Health 3.0 that then is less expensive, more effective, and then you can actually expand whoever pays for it, whether it's employers, whether it's government, whatever, in a way that actually you get what you pay for instead of what we get now, which is horseshit. No price transparency. You show up in the ER, you don't even know what you're going to pay.
No.
It's a hospital charge master. Like, no other sector of the economy would we allow this. The problem is doctors are full of inertia. They're full of fear. They're ruled by a hierarchy that was instilled in them in education. Nurses feel powerless because that's how the hierarchy of healthcare puts them in. The administrators, the doctors, everybody else seems to be above them in the hierarchy, so they feel like they don't have a voice. But man, what happened if we all stood up and said, now we have a voice. We actually know what to do. We've seen it in fits and starts in bright spots around the country. Why can't we do it?
Inertia.
It's inertia, it's money, it's the system opposing, and it always does, but eventually something will crack. And we're part of that crack. We're part of the thing saying, you know what? Hey, we've got 620,000 followers. What happens when we reach 1 million? What happens when we reach 5 million? And every night we do this show, and it's the voice of healthcare. Like, the people are going to have to listen.
It's not going to be like all rainbows, though, when things break down. It's going to get worse for a period of time, right?
Yep.
And are people willing to deal with that?
Well, that's the thing. Are you willing to do that short-term disastrous chaos sacrifice? In a way, we're in that period.
No politicians are willing to do that.
Nope.
None.
Nope.
The market is willing to do that, and that's efficient market hypothesis. That the market will take it in that direction, whether you like it or not, and you're forced to endure that downturn.
I agree with you on a long macro sense. In a short micro sense, do you think a CEO wants to risk his next quarter's bottom line by doing risky shit?
No, because we need to change how CEOs are paid, obviously,
Yeah.
right? They should be paid on a long macro scale.
Yeah.
They should be paid only in stock.
Bitcoin.
Yeah, Bitcoin.
Yeah, pure stock. But see, if they're paid only in stock, then they're going to want to game that stock price. And the way you do that is earnings each quarter. So we have to figure out the subtlety of how do we get their pay actually gamed to long-term outcomes for their company and therefore for the country. Because when companies do well, actually, people do well.
Yeah.
Because, Mitt Romney used to say, right? Companies are people, and everyone took a shit on him. All the liberals were like, wait a minute, that's a dick statement. It's actually a true statement. They're made up of people, they employ people, they pay taxes. So optimize their function. Yeah. And you optimize the economy.
Now then, the problem with the reason why people say, hey, screw you, Mitt Romney, is because of the diffusion of responsibility that happens within corporations, because when you have so many people making decisions, suddenly nobody's in charge, and then I didn't do it, Bob in accounting did it. Like,
Dude,
it wasn't me.
You see it all the time. You see it in companies like United Health. They'll start a little innovative little project, and then Bob in accounting will be like, squash that project, it's working.
Right, exactly.
I mean, it's total bullshit.
Check it out. I'm going to hit you with a hard question. Hypothetically, I reset the entire board.
Do it.
We erased the last 60 years of medicine, and the government never got involved to the degree it got involved. Are we now, in 2017, farther along than we are right now?
So we're totally reset to zero.
There's we're at zero, and
Nope.
the market worked on its own. There was no government interference regulation. We never had Medicare or Medicaid, and we let the system run itself. Where are we? Are
Oh.
we better or are we worse?
Well, this would have been a decision point in 1969 or whenever Medicare went online.
Yeah.
And what would have happened is, at some point, I think there would have been a tipping point where Medicare would have come online because people would have been outraged at escalating costs. Because ultimately, if the employers are paying for insurance and it's a benefit, and this is what was happening, is it kept escalating. And seniors were like, wait, we don't have any money to pay for this insurance anymore. And
I'm actually getting a breakthrough here. So this is a fundamental problem with healthcare rather than something like the iPhone, right? Like, it doesn't matter how expensive computers are for a long time because you can sit on the sidelines until computers become cheap.
Right.
But you can't sit on the sidelines of your own health.
Yep.
So how do you get over that?
You also can't, you often can't make educated consumer-based choices because
Yeah.
you don't have information, you don't have price transparency, and you also don't have luxury sometimes because you're having a heart attack. Well, I don't get to choose which hospital I go to. I don't get to choose which doctor with the best outcomes. I don't
Right.
get to choose which stent product is the cheapest, made at the most volume, that's the safest.
But I'm right, aren't I? Like, if we let it run and we could somehow magically seal ourselves in hermetic bubbles where we didn't need healthcare, right?
Yeah,
the market would eventually work it out.
Yeah, it
but
would.
Since we can't do that, we're stuck in this constant compromise.
And the fact that we started healthcare as a cottage industry in the 20th century where it was this very guild-like apparatus. It was anti-competitive. It was, the doctors kind of ran it, and they sat on the boards of directors of the insurers that were paying them.
Right.
And it was that kind of thing. And they just behaved the way humans would behave when those incentives are in line like that. So,
Of course.
this
Like an
is a
economy system.
nice thought experiment, but the question is, what do we do now? You can't defibrillate the entire thing and start from scratch unless, and our guest next week is going to actually talk about that. What happens if you just blow it up?
You have to talk about it, though, from a hypothetical viewpoint because, the politicians that are arguing over it from right versus privilege. Like,
Yeah.
we're here beyond that, but they're there. And
Yeah.
you need to tell them, like, I actually understand now better having this conversation as somebody who's far on the economic right, that it actually doesn't make sense because human bodies are frail and we need healthcare all the time throughout this process. You can't defer your healthcare and then get better healthcare later. It doesn't work like that because if you're dead, you never get to later.
It is, healthcare is exceptional in that way. And we hate to use that term exceptional, but it really is. It's a different kind of entity than your standard market thing. Does that mean, though, that you can't apply some market theory to it? No, of course you can. Does that mean that you can't, use lean or some of these assembly line processes? You can. Here's where it goes wrong when you apply that to the exclusion of what makes it exceptional, which is it's a human relationship, there's a unique vulnerability, everybody needs it at some point, et cetera. Now, I think what the politicians do is they try to appeal to the elephant. They try to appeal to the horror, disgust, fear, hope, those kind of things. So right versus privilege exactly appeals to the Republican and Democrat elephants.
Yeah.
So what about the writer that's actually doing the planning? No one's appealing to that.
Here's a perfect liberal elephant standpoint is Colleen Garvey says, this is a moral issue. And Republicans don't think that way. We think it's an efficiency issue. We don't think anything about the morals of who deserves health care and who deserves what. We think this doesn't seem to work. None of the numbers add up. Everybody's going to end up sicker. I don't understand what you're, it's great to say, everybody should get health care. Yeah, everybody should be a billionaire too, but it's not going to happen.
The way I see it is it's a moral issue to try to find a solution for the most possible people.
Yes.
So if it takes
Concur, but you can't make a blanket statement like everybody deserves it.
Yeah.
No, because what does the word deserve mean?
Right.
What does right mean? So I have the right to I have the right to free speech. Okay. So I'm born with this right. I can say what I want unless it impinges on the free speech of others. I have the right to health care. Well, here's the dicey part about that. You're saying you have the right to someone else's services.
Yes. That's
You have the
problem.
right to someone else's labor.
And that's a moral issue when you think you can steal from somebody else. If the three of us in this room, if you two decide to vote and take away my shit, well, that doesn't make it moral because you took a vote. It's still wrong to take things from me without my consent.
Right. But here's what I would say is, as a species, as a country, we are better than not letting our most vulnerable citizens have access to safe, efficient, and cost-effective care. we have fucked up by not creating that safe, efficient, and cost-effective care that's then easy to afford, that people through a social covenant would say, you know what, I'm willing to give a little bit in taxes so that the homeless guy in the street doesn't die of gangrene with a maggot-infested wound. And whether or not you believe he made bad choices or not, or he has genetic mental illness, whatever it is, I, as a society and as a member of society, am willing to support this person. And this is what they do in Scandinavia, because I think they see themselves all as one family because they are quite homogenous. They're generally willing to do that. In the US, I think we can do that, but you can only do that if you actually improve the cost, quality, efficiency of care. And that's what we're missing. That's why it can't be done.
Yeah, and homogenous is just a big word for they're all white.
No, they're not even that. It's they're all the same, they're genetically related.
They have the same genetics, the
Yeah,
same culture.
exactly.
They're all white. They all wear wooden shoes. They're all a bunch of losers. They all eat cheese blintzes. I mean, like, these are facts, people.
They're all named Hans from the Seven Isles.
Yeah.
They all have the lutefisk. This is just the worst show ever. But you guys get what we're trying to say here. Is like, evolutionarily, you support your family, and that's how I think. And again, I may be extrapolating, but this is just from the information that I have. So that being said, what do you think, Tom? You want to take some comments and then wrap?
Yeah, let's do that. So Steve says, fundamental challenge is the innate American mindset of individualism. If healthcare is a right, many do not want the responsibilities that ensue to be healthier and cost the system less. Stop smoking, lose weight, eat healthy, etc. If it's a privilege, there is no cost-effective and efficient safety net for those most vulnerable. And this sort of blends into non-compliance, I think.
Yeah.
So how do you create a system for people that don't even want to be a part of your system?
I mean, do you see how fraught this is politically? Because
just logically.
Well, logically, politically, but the political elephants are different. So the liberal elephant feels that people really should, fairness and equity are a main goal here, whereas the Republican or the conservative elephant feels that it's about personal responsibility, accountability, loyalty, deference to certain authority, etc. How do you reconcile those when we're all human beings? We actually all, people really do like each other and get along generally.
But this is the big problem with the political conversation is, like, the left always wants to say that the Republicans don't care. We're just, like, they think that Republicans are all just a bunch of amoral, like, hillbillies that live in the swamp somewhere. And
that's just Logan.
Guess what?
I'm a libertarian, Z.
That's
Republicans true. Republicans do care. Republicans care a lot. Okay? They just have a different methodology for how to get where they're going than you do.
No, I mean, I agree with you. And I wouldn't have agreed with you 5 years ago when I was sort of entrenched deep in the sort of liberal bubble of the San Francisco Bay Area. And it took actually coming to Vegas where I could see how other people think, because it's really true, and especially in like places, the coastal cities, you do get a certain mindset and you think there's really no other mindset that makes sense. Those people must be crazy. Yeah. Now there are certain people on the right who definitely feel that way about liberal mindsets. They cannot understand the concepts of social justice, of the idea that a black guy gets arrested and it might be because he's black. Right. Like, so stuff like that. So it's really interesting. My feeling is I've moved much more to the center, but I also try to understand both extremes as well, because they're all human beings trying to do the right thing within their moral parameters. And once we respect that, then you stop demonizing the enemy. It started in the 90s, demonizing the other side of the aisle. Both sides did that.
Well, think about all the things that we actually agree on as a people. Like, society works pretty well. Go outside and just look at everybody driving around in their cars.
Dude, and I think all of us can agree chalupas are the shit.
Yeah.
Okay? We can agree that no one wants to eat a churro at Taco Bell because those are bullshit churros.
Yep.
You get them at Disneyland.
We are evolving as a society. Like, and this is like, the left is like, well, we're the ones who push it forward. And the right is like, well, we're the ones who make sure you don't push it so far forward we fall over a fucking cliff, because you guys are insane, honestly. And you have, like, no idea how things actually work. You're not the adults. We're the adults. Anyway.
I love how I was getting so moved by your speech. Like, oh my God, this is going to be such a consolatory, let's bring people together. And he's like, yeah, but you people are children and fuck all y'all.
That's my elephant, Z.
But I love it.
See, I'm socially far left.
That's true.
I'm economically far right.
You're really
being smart.
You're a libertarian. Called being smart. You're a libertarian, and so is Logan. And I'm somewhere in the moderate spectrum, but again, I used to be very, very much more on the left, and I couldn't understand the right's thinking. Now, I don't understand either extreme's thinking in terms of excluding the other's pattern of thought or morals, etc. The one thing I don't really, I understand, but I don't ever sort of, I can't ever support without saying something is like a fundamentally racist or fundamentally sort of sexist, you know, something where it really is, you just listen to it and you go, okay, that's from 1930. Like that kind of thinking, we really have to just not even tolerate it, because if we're gonna push forward in any way, conservatively or democratically, doesn't have a place.
There's a video going around of a guy wearing a swastika armband, and this dude just knocks him out cold. This is the greatest video of all time. Like, fuck you, Nazi. You get what you get, man.
I think we can all agree that Nazis should get punched. I mean, and again, it sounds bad and it sounds like you're taking an extreme view, but not really, because they, you know, killed 6 million Jewish people and wanted to create a master race. That thinking has no space in a modern society. It just doesn't. Yeah,
it doesn't.
So on that note, genocide. Shoot, what does Tad have to say about this? UNLV, bitches, all the way. Yeah. Tad's my hero. Guys, thanks for spending time with us. We're really humbled when you take time out of your afternoon. A lot of you guys are working and on the download creeping. Hit share, hit like. Like, we love doing this show. If it doesn't come through with how we behave on the show, then you're missing something, because we love it. We look forward to it. We just put out a video, Dr. Man, featuring my boy Doc Vader. It's an Elton John parody. Check it out. It's about working nights. Hit share. It really helps us out, helps us spread the word, because if we're going to have a voice, as many people who are screaming at once, the better it is. I don't know, Tom.
Listen, the final thing I have to say on politics is, if you're the kind of person that thinks that black people are inferior to you, you can go fuck yourself. But also, if you think that you're a Foxkin and you can just identify as whatever the hell you want, you can also go fuck yourself.
How dare you, Tom? I'm an Apache helicopter.
Yeah, Logan identifies as an Apache helicopter because of guns and America. And we out.
Fix healthcare, yo!
Go.
Or don't. I'll just go to Canada. I don't give a fuck. I like Canada. Beaver, bitch.
You know, I'm a believer. I'm a believer for sure.